I just want to again reiterate, thank you so much for joining. We're really excited to do this presentation, and we've got a lot of great feedback that people really want the recording too. So we appreciate you taking time out of this beautiful day to join us. So we're just going to be talking about different topics today around substance misuse, distracted driving, and kind of tips on how you as a parent, caregiver, or an adult mentor can talk to youth in your life around how to stay safe during different life circumstances like prom or graduation. And as Andrea mentioned, this is going to be recorded and will be sent out. So keep an eye out for that. There we go. Before we get into any content tonight, I just want to give you an idea of what our agenda is going to look like. So soon I'm going to introduce our team, and then we're going to go into our content around state and national statistics, transition into information around distracted and impaired driving, and then follow that information up with some useful tools that you can all use to keep your team safe, with specific examples and information from SAMHSA's Talk They Hear You campaign. So we're going to be sharing a lot of information, and it's a smaller group, so feel free to just come off mute at any point if you have any questions or comments, or you can put something in the chat. These are just our objectives for tonight. The first is to understand relevant state YRBS stats and where to find these reports, understand, recognize, and know the importance of distracted and impaired driving, develop tools to keep your team safe while on the road and at parties, know how to access the Talk They Hear You campaign that Andrea will go over, and then develop ways to talk to your teen about topics around substance misuse prevention and safe driving. So just some really quick introductions. The three of us are the presenters for tonight to talk about these subjects. My name is Darren Smith, and I'm the Substance Misuse Prevention Coordinator for the Greater Sullivan County Public Health Network with Dartmouth-Hitchcock Medical Center. So in my role, I do a lot of youth substance misuse and suicide prevention stuff, so different initiatives around programming, alternate activities for youth, education, really any way that I can support the youth in our community. And I will kick it off to Andrea.
Thanks, Darren. Hi, everybody. My name is Andrea Smith. So like Darren, I am the Substance Misuse Prevention Coordinator, but I focus on the Upper Valley region of New Hampshire, which also covers parts of the Vermont, border of the Upper Valley as well. In my role, I also co-facilitate All Together, which is our region's Substance Misuse and Suicide Prevention Coalition. And I will pass it to Lexi.
Thank you, Andrea. Hi, everyone. Thank you so much for being here. My name is Lexi, and I'm the Youth Operator Program Coordinator in the Injury Prevention Center. A part of my role is working with teens, the parents and caregivers, and the school systems all through New Hampshire regarding educational material and support around safe driving for the youth.
Awesome. Thank you very much. And I will kick us into our first topic today, going over state and the kind of national stats around substance misuse. So first, I want to just give you some information about the YRBS, or the Youth Risk Behavior Survey. This is the data that we're going to be looking at for kind of the first part of this presentation. This is a survey that's conducted every 2 years by the CDC, and it's disseminated through high schools, and then if middle schools have the funding to do so, middle schools can opt in to do that as well. It's an anonymous survey, so youth are able to answer honestly without the fear of getting in trouble or anything. And this survey's overall goal is to just gain a better understanding of trends, issues, or additional support that's needed for the youth population around different topics. And there's 6 different topics for the YRBS. It is behaviors that contribute to unintentional injuries or violence, sexual behaviors that contribute to unintended pregnancy and sexual transmitted diseases, including HIV infection, alcohol and other drug use, tobacco use, unhealthy dietary behaviors, and inadequate physical activity. And it also measures the prevalence of obesity and asthma among youth and young adults as well. So just to give you a little understanding about how we use it, the data from this survey is used by health departments, schools, local agencies or organizations to really just define areas of high health risk and to secure the resources necessary to address any identified issues. The results can take around a year to come in. So we try really hard as soon as we get to the results to put all our efforts into doing these programs, services, initiatives, and stuff for our population. So we will be sending out links to the New Hampshire, the Vermont, and then all the different regions YRBS surveys. So if you want to take a peek at your own regions or the states, Andrea will be sending that out after. And we just had the youth fill out the 2021 survey in the fall. So we're hoping that will come in the next couple months. So for the purpose of this presentation today, we are going to be talking about results from the 2019 YRBS survey. So if you look at the two tables on this slide, the tables show a comparison of past 30-day use of substances, including alcohol, marijuana, prescription medication, tobacco, and electronic vape products, also known as vapes. As you can see, New Hampshire's youth responded higher uses of marijuana and electronic vapor products than our national average, while they responded lower uses of consuming at least one drink of alcohol in the past 30 days than the national average. New Hampshire youth reported the same amount of use for binge drinking, prescription medication, and if somebody has ever used an electronic vape product compared to the national average. You can also see that Vermont youth responded higher uses of alcohol, marijuana, prescription medication, tobacco, and electronic vape products compared to the national average. This slide here is looking at perception of harm around alcohol, marijuana, and prescription drugs in New Hampshire. So perception of harm is related to the thought that youth think that they risk hurting themselves by using a certain substance, or the perception that their parent or friend would think that it's wrong or very wrong for them to use a certain substance. As you can see, the data shows similar trends throughout the slide, showing that prescription drugs have the highest perception of harm, with alcohol having the second highest perception, and then marijuana having the lowest. You can also see that youth believe that their parents think it's very wrong for them to use these substances at a much higher rate than their friends might, but individuals have a shockingly low perception of harm for themselves. So for example, if you look at this slide, you can see that 91% of New Hampshire youth think that their parents think alcohol use for youth is wrong. 65% of youth think their friends would think that it was wrong, yet only 27% of youth think that they're at risk. So this is pretty fascinating to look at, because you know that their parents find these substances harmful, yet the youth themselves don't think that it's harmful. So this is a lot of information to go through quickly. So again, we're going to make sure to be sending these slides out after, so you can take a better look. This slide right here is actually, I might skip this one because it sounds like we're all from New Hampshire here. But again, take a look at this in the slides once it's sent out. This is just the same statistics of perception of harm, but for Vermont. Hopefully I haven't lost you guys yet with all this data, but this is just the one last slide that goes over ease of access for alcohol, marijuana, and prescription medication, along with impaired driving stats. So I think knowing we're going into prom in graduation season, ease of access is a very important topic to consider when having conversations with your child or another youth. So in New Hampshire, 32% of youth felt that it would be very easy to get alcohol, 39% thought it would be very easy to get marijuana, and 10% thought it would be very easy to get prescription medication. While in Vermont, 36% of youth felt that it would be very easy to get alcohol, 38% thought it would be very easy to get marijuana. And then when it comes to impaired driving, 44% of New Hampshire youth and 35% of Vermont youth have texted or emailed while driving. 5% of New Hampshire youth and 6% of Vermont youth drove while they have been drinking alcohol, and 15% of New Hampshire youth and 17% of Vermont youth drove in a vehicle driven by someone who had been drinking alcohol. you're anything like me, you'll think that these impaired driving stats are pretty scary. And I think that a lot of times people just don't understand what impaired driving is. So luckily, our youth operator program coordinator, Lexi, is here with us tonight to kind of just go over what impaired driving and distracted driving is, and how to lead by example. So take it away, Lexi.
Great, thank you, Darren. So we're actually going to take a moment and play a short clip here.
Hopefully I shared my screen the right way and that you can hear this.
Yo, Jake! I'm sorry.
If you feel different, you drive different. Drive high, get a DUI.
So exactly what they said. If you feel different, you drive different. So you're going to get a DUI. And this campaign aims to educate people that drive while drug impaired, putting you, your passengers, pedestrians, and others on the road in danger. This campaign typically runs from December 15th through January 1st and provides a powerful message. Drivers are making riskier decisions when they're behind the wheel. An estimated 20,160 people died in motor vehicle crashes in the first half of 2021, which is up 18.4% over 2020. And from 2009 to 2018, the presence of marijuana nearly doubled among drivers who were killed in traffic crashes and tested for marijuana. So, what is impaired driving? According to the Center for Disease Control and Prevention, impaired driving happens when someone operates a vehicle while impaired by a substance like marijuana, other illicit drugs, some prescribed or over-the-counter medications, or alcohol. 56% of drivers involved in serious injury and fatal crashes who tested positive for at least one drug, and 1 in 10 teens in high school drinks and drives. So I know there's only a few of you here today, but I would still love to hear from you all. We are going to take a moment to take a short poll. The question is, how much do you think a DWI, driving while impaired or driving while intoxicated, costs? You can answer with 3,000, 5,000, 10,000, or 12,000. And Darren will get that pulled up.
Awesome.
And as you answer this question, please take note of the image provided on the side. This gives information regarding how long substances can remain in our systems. Keep in mind that this also varies depending on a person's age and weight.
Can you guys see the results?
Perfect, yes.
Okay.
So if you answered C, $10,000, you are correct. However, that is the minimum cost because that does not include lawyer fees, vehicle towing fees, and other violation fees that may come up. In addition, you will have to pay for a breathalyzer to be installed and removed in all vehicles. Under the New Hampshire Ignition Interlock Device Law, also known as New Hampshire IID, a driver must install a device in every vehicle that they use on a regular basis. For some people, this may mean having multiple devices if they drive more than one vehicle. The device must stay installed for 1 to 2 years. The installation fee can be between $70 to $100 with a monthly fee of $60 to $90, and then another $70 to $100 fee for it to be removed. All IIDs are leased and not purchased outright. The IID is about the size of a TV remote. So imagine paying that much for a small little TV remote sized device. It comes with a handheld unit, a mouthpiece, the relay cord, and a camera unit. Once the device is installed, drivers blow into the car breathalyzer mouthpiece to provide a breath sample. The device tests for breath alcohol content within the legal limits. If it's under the legal limits, then the driver can put their keys in the ignition and start the car. And lastly, your insurance payment will go up a substantial amount. This slide provides information on the dangers of drunk driving. From 2009 to 2018, 354 people were killed in crashes involving an alcohol-impaired driver in New Hampshire. The National Highway Traffic Safety Administration reports that an impaired driving injury occurs once every 2 minutes in the United States. And there's 3 in 10 likelihood that we will be involved in alcohol-related crashes in our lifetime. And 11,000 Americans are killed each year in traffic crashes due to drunk driving on average. In New Hampshire, it is illegal to drive with a breath alcohol content at or above 0.08%. Publicized sobriety, I knew I was going to butcher this. Sobriety checkpoints are allowed, and ignition and or locks, which we discussed, are required for all convicted offenders. Furthermore, some fast facts included: driving with a blood alcohol concentration above the state's illegal limits are considered alcohol impaired by law. More than 10,000 people in the United States die each year in crashes that involve an alcohol impaired driver. On a positive note, according to the CDC, because of the dedicated efforts, rates of alcohol impaired driving and alcohol impaired fatal crashes in the United States have gone down since the 1980s. But still, alcohol impaired drivers get behind the wheel millions of times each year. And this is another great discussion point to provide to your teams, because although they may not be involved in this behavior, there are others still on the road that they need to be aware of who are alcohol impaired. Another great discussion would be talking to your teens about distracted driving. So, what is distracted driving? According to the National Highway Traffic Safety Administration, distracted driving is any activity that diverts attention from driving. The 3 main types of distracted driving is taking your eyes off the road, taking your hands off the wheel, and taking your mind off driving. Examples of this is texting or talking on the phone, eating and drinking, talking to others in the vehicle, fiddling around with the radio or navigation system, and doing your hair or makeup. As crazy as it sounds, a lot of officers have actually pulled people over for doing their hair and makeup. So it does happen. Basically, any non-driving activity your teenager engages in is a potential distraction and increases their risk of crashing. Following up with your young drivers about violations of distracted driving laws is important because New Hampshire actually has a hands-free law that went in effect on July 1st, 2015. Violating the hands-free law can result in the following fines: $100 for the first offense, $250 for the second offense, and $500 for a third offense. That is a total of $850 just for violating the hands-free law. Among fatal crashes involving distracted drivers in the United States, in 2019, a higher percentage of drivers aged 15 to 20 were distracted than drivers aged 20 and older. Among these young drivers, 9% of them were distracted at the time of the crash. Reaching for something in your car actually increases your chance of a collision by 9 times. And 3,000 people die in crashes involving a distracted driver every year. While driving, it is important to know your surroundings. About 1 in 5 of the people who died in crashes involving a distracted driver in 2019 were not in vehicles. They were actually walking, riding their bikes, or otherwise outside a vehicle. Teens who text while driving spend actually 10% of their driving time outside their lane. In addition, drivers who are sad, angry, or upset increase their risk of crashing by up to 10 times. At 55 miles per hour, sending or reading a text is like driving the length of a football field. According to the 2019 YRBS, 39% of high school students who drove in the past 30 days texted or emailed while driving on at least one of those days. Students who texted or emailed while driving were also more likely to report other transportation risk behaviors. These include more likely to not always wear a seatbelt, more likely to ride with a driver who had been drinking alcohol, and more likely to drive after drinking alcohol. Don't drive impaired or distracted. Hands on the wheel, eyes on the road is best practice. I hope I have not lost you yet, as I know there is a lot of information to take in. We all know that events are fast approaching, such as prom, graduation, and summertime activities. This is why we are providing this information, as it is a perfect opportunity to discuss with your teens that safe driving is essential to getting everyone to and from their special events safely. Use this important time in their lives to remind your teens of the expectations and ground rules you have set for them around driving. Talking to your young drivers about the distractions and all the responsibilities that come with driving. After having those discussions, have your young driver sign the "it can wait" and or driving towards zero pledge to commit to distraction-free driving. Your teen is always watching what you do as well. So lead by example by modeling how to drive safely, as this is the most effective way to teach your teens to do the same. These safe actions look like buckling up before every trip, going the posted speed limit, and avoiding picking up your objects, such as your cell phone, eating and drinking, and playing with the radio, or other actions that will divert your attention from the road. So this slide here will provide further resources regarding impaired driving and distracted driving. We encourage everyone to visit these websites as they continue to encourage everyone to share the road and get to where they are going safely. Now that I have provided information and resources for distracted driving, impaired driving, and leading by example, Andrea will continue by providing other factors and helpful tools regarding tips for keeping your teen safe. Thank you very much.
Thanks, Lexi. So before we get into these tips of keeping your teen safe around these milestone events, I want to take a minute and have us think about why a teen might start to drink or use other substances. So you can see here, if we look at factors like stress, peer pressure, different life transitions, these types of things might increase the risk of your child using alcohol and other drugs. But keep in mind that kids can also be influenced by watching what the adults in their life are doing as well. So I want you to think about, how do you cope with stress or peer pressure or different life transitions? So even though these factors may seem out of your control, there are things that you can do to help your child, or again, a young person in your life. So when it comes to them experiencing stress, it's important to encourage them to get involved in maybe sports or other activities that will lead to a healthier way to cope with some of their problems. When it comes to peer pressure, which we'll talk a little bit more about shortly, it's important to help your child learn different ways to say no, and to remind them that their real friends or true friends are not people that are going to be pressuring them into using alcohol or other substances. And then when it comes to different transitions, excuse me, it's important to reassure your child that things will eventually get easier, and make sure that they understand that drinking, using other substances, those are not healthy coping mechanisms, and that's not going to lead to a healthy solution for them. So let's continue to think about these different life transitions or big milestones in a teen's life. Thanks, Darren. So depending on your teen, things like maybe ending a senior athletic season, or going to prom, or graduating, those are probably some of the more significant events that happen in a teen's life that we would associate partying with. So healthychildren.org, I'm not sure if anybody's familiar with that, but that is a great resource for all things children from newborn to 18 years old, excuse me. And they have some really great tips and things to keep in mind if your teen is going to go to a party. So that's what I want to focus on on this slide. So communication and honesty are really important to keeping your teen safe. So teens whose parents talk with them regularly about drugs and alcohol, we know that they're 42% less likely to use substances than those whose parents don't have these conversations. So it's important that you tell your teens that you expect them not to use alcohol or other substances at parties. Another tip is to know where your teen is going and how long they're going to be there. So have the phone number and the address of the party that they're going to. Make it a verbal agreement with your teen that they will call you if the location of the party changes or if they're going somewhere that you were not expecting them to go, so that you know where they are at all times. And that's for safety purposes. That's not for you, as you being a helicopter parent. It's just simply to, as a safety precaution to know where they're going to be. And be sure to let your teen know where you're going to be during the party as well. Another tip is that you can call the parent of the party host. So that's a way for you to make sure that a parent is going to be home, a parent, adult, caregiver is going to be home the entire time and supervising the party. And that's an important part. We want to make sure that they're going to be home and knowing what's going on, that they're not just letting people, go down to the basement and they're going to go upstairs and go to bed for the rest of the night. And make sure that alcohol, tobacco, other substances are not going to be allowed. Talk with your teen beforehand about how to handle a situation where alcohol is available at a party. So it's important to practice ways for them to turn down alcohol or other substances. And it's really important to give them that practice in a safe space. So while you're at home, we don't want them trying to turn them down for the very first time when it's, somebody that maybe they have a crush on or something like that is offering them, something to drink. We want them to be comfortable and have that practice before. And then we want to make sure that your teen has a way to get to and from the party. So make it easy for your teen to leave a party by making it clear that they can call you at any time for a ride home, no questions asked. You may not be happy about it, especially if it's at like 1 o'clock in the morning or something like that, but they need to know that they can call you if they don't feel safe, if they don't feel uncomfortable, and that you're going to be there to pick them up. You're not going to lecture them in the car. You're going to get them home safely. And then maybe the next day or the day after that is when you can have that conversation about maybe what your expectations were and, where did things change along the line. I've also heard people say that they have come up with a code word or a phrase for their teen to use with their parent or caregiver that signals that they're not comfortable and that they want to leave without making it obvious to their friends that they want to leave the party or whatever situation they're in. And then another tip is if you're able to try to stay awake and be up to greet your teen when they get home. So this can be a good way to kind of check the time, check in with them, talk about the evening. And then if your teen is staying overnight at a friend's house, after a party, again, verify this arrangement with that friend's parents and that they're going to be home. Excuse me. So what about if you are the one that's going to be hosting a teen party? So there are some things to keep in mind if you're going to be, being the host for that. So you want to plan in advance. So go over the party plans with your teen. Encourage them to plan non-alcohol related group activities or games so that they don't find themselves bored and then just end up leaving to go to, a party where substances are going to be present. Try to keep the party small. So when teens plan a party, news spreads very quickly via social networking sites like Snapchat, Twitter. I'm not super up to date on other ones, but I do know Snapchat is still pretty big. So parties can grow too large for parents to control. So it's also important to make sure at least one adult is present at times. I think I was reading when I was doing my research for this that they recommended that there's like one adult for every, I think it was like 10 to 15 youth there. So maybe keep that in mind. So, ask other parents to come over to help you if you need it. So that way, if it does start to spread a little too quickly, you've got some backup to help, shut the party down or at least keep it at an amount that you're comfortable with. So in addition to that, setting a guest list is important. So the party should be for invited guests only. We don't want any crashers allowed. So this is just going to help to avoid the open party situation. And then setting starting times and ending times for the party is important. You want to check your local curfew laws to determine an ending time because it's very easy for somebody to put in a noise complaint if you have neighbors close by. So you want to be respectful of things like that. And then setting party rules and your expectations. So again, having this conversation and discussing this with your team beforehand is important. And some examples of rules would be, make it explicit that you are not comfortable with having alcohol or other drugs there, that nobody's able to leave the party and then come back. Either they need to stay at your house until they're ready to leave for the night, or they can't come. If it's something inside, saying that lights need to be left on at all times, and then making it very clear that certain rooms of the house are off limits if that's something that you're looking to do. It's important to have plenty of food and non-alcoholic beverages available for them. And just as a side note, try to make sure to put your alcohol and over-the-counter prescriptions in a locked cabinet or in a room that is off limits to people. And then the last tip is to be there, but not square. So, pick a spot where you can see what's going on without being in the way, without making it obvious like you're hovering or kind of helicoptering, but you want it to be known that your presence is there. That way, I thought this tip was funny, so I kept it in there, but you can also help to serve snacks and beverages at that point. That's maybe a way to make it not as obvious that you're, there to check in. You're just there to check on the drinks and the food and, the non-alcoholic drinks and the food and things like that. So all of these tips can help you make sure that you as the parent or the adult in their life are set up for a safe celebration. But if you choose to host a party, there are some things that you need to know when it comes to having teens at your house. Excuse me. So parent networking is really the best prevention, one of the best, prevention tools to combat underage drinking. So before I get into a little bit more of what adults need to know, I wanted to throw this in here. So it's important to try to get to know your teen's friends and their parents as well. So if your teen, again, is planning on going to the party, you want to call them, make sure that they're going to be there. And then if really that's not possible, don't let your teen go. So the part that I want to point out is something called social host liability. And what that means is that parents are legally responsible for anything that happens to a minor who has been served alcohol or other drugs in their home. So if anyone brings alcohol, even if it's not you supplying it, if anybody brings alcohol or other drugs to your home, you need to be prepared to contact their parents. And if somebody comes to your home already intoxicated, make sure that you help get them home safely, figure out a plan to get them, out of your house and home safely. And help your teen feel responsible for this as well. So I do want to point out that parents and adults may be criminally or civilly liable if any of these following things occur. So if alcohol is just provided to a minor at a party that they've organized, if someone's property is damaged, somebody gets injured, somebody leaves and gets into a car accident and or injures somebody else, or if somebody dies. So it's really important. I would encourage you to do a little bit more research into this if you're planning to host a party, just so that you understand the risk that you are putting yourself in as well. It's important to understand local laws about alcohol and other drugs, and this can vary from state to state. So again, make sure you look into that. But we do know in New Hampshire and Vermont, there's up to a $2,000 fine in addition to potential jail time if any of the above things were to occur. And obviously the penalties can be much more severe depending on what it is that happens. And again, that's not to scare you, but I think it's something where we often hear parents and adults think it's the safer option just to have all of the kids come to their house. But we want to empower you to know all of the risks and benefits to hosting a party at your house for underage teens. And so we know that this can all seem pretty overwhelming. So, we have a little bit of time left. So I want to just get a quick feel for how prepared you're feeling to talk with your kids about underage drinking and other drug use. So Darren's going to start another poll for us. So do you feel very prepared, somewhat unprepared, or, I have no idea what I'm doing. I don't even know where to begin. Okay, so we're feeling somewhat prepared and somewhat unprepared. So that's helpful. Thank you for sharing that. So, excuse me. You can go to the next slide, please, Darren. Thank you. So while it's never too late to have conversations with your child about alcohol and other drugs, it's also never too early to start these conversations. Ideally, the best time to start talking with your child or the youth in your life about alcohol and other drugs is before they're exposed, but we know that that isn't always the case, and that's not always going to happen. So our advice is if you approach the conversations directly and honestly, your child is more likely to respect your rules and your advice about alcohol and other substances. So we encourage you to have lots of little talks to keep the lines of communication open, because we know that having those little talks works much better than having just that one big talk. And although it may not seem like it, research does show that young people really do listen to what their parents have to say about alcohol and other drug use. So it's important to start having those conversations. Give them the opportunity to hear what you think and how you feel about alcohol and other drugs. And so the rest of the information that I'm going to share with you, and that previous information as well, all of this comes from this campaign from SAMHSA called Talk They Hear You. And so this is a national media campaign, and really what this does is it provides parents and caregivers tools and resources for them to have conversations with their kids early and often to prevent underage drinking and other drug use. And like I mentioned, this campaign was created and developed by SAMHSA, the Substance Abuse and Mental Health Services Administration. So the goals of this campaign are to help parents get informed, to be prepared, and take action. So let's look at some of the resources from this campaign. So research suggests that one of the most important factors in healthy child development is a strong and open relationship with a parent, adult, mentor, caregiver. So like I mentioned before, it's important to start talking with your children about alcohol and other substances before they're exposed to them. And it can be even as early as 9 years old. So here you see from this Talk They Hear You campaign, they've developed 5 conversation goals. So using these 5 conversation goals as a way to help you get started is a great idea. But remember, you want to keep it low key. So don't worry about getting everything across in one talk. And again, like we've said before, that's may not be the most effective to do it at one time. So plan to check in often and do little quick chats with the child in your life to keep the lines of communication open. So when we look at conversation goal number 1, over 80% of young people aged 10 to 18 say that their parents have an impact on their decision whether to drink. So don't make the assumption that they know how you feel about drinking and using other drugs. Send that clear and strong message that you disapprove of underage drinking and other drug use. For conversation goal number 2, young people are more likely to listen when they know that you're on their side. So remind your child why you don't want them to drink or use other drugs. Ultimately, it's because you want them to be happy and you want them to stay safe. So this conversation is going to go a lot better if you're open with them and show your concern for their well-being rather than just, talking at them or lecturing them about this. Conversation goal number 3. You want your child to make informed decisions about alcohol and other drugs with reliable information about the risks and dangers. You don't want them to learn about this from bad sources of information, from hearsay, gossip, things like that. So make sure they know that you're a trustworthy source of information. And if you don't have the answer to one of the questions they ask you, be honest about that and just tell them, I don't know, I have to look it up. Let's continue this chat tomorrow after I've had some time to think about it. And that's okay. And for conversation goal number 4, young people are more likely to drink alcohol or use other drugs if they don't think anybody's noticing. So show them that you're aware of what your child's up to, but try to do this in a subtle way and trying not to pry. Again, I've used the term helicopter parent before, so kind of keep that in mind. If you're going to ask about friends and plans because you care, make it clear that you're doing it because you care and not because they're judging. They're more likely to talk with you openly when you come across that way. And then the last goal is, even if you don't think that your child wants to drink alcohol or use other substances, peer pressure from their friends can make it hard for them to say no. So having a plan to avoid underage drinking and other drug use can help them make better choices. So talk with them, about what would they do if they were faced with that decision. And like I talked about before, practice having them say the no thanks with you in the safe environment. And again, keep it low key. And so here are just, answering your child's tough questions. So I'm not going to necessarily go through these because this is something that is a resource on this campaign, but I just wanted to point out to you that it does give an opportunity for giving you some maybe conversation starters or ideas of what to say if your child comes at you with some tough questions that you're just not quite sure how to answer it. So for example, if they were to ask you, well, did you drink or use drugs when you were a kid? If you're not quite sure what the best way to answer that, this gives you some ideas of how to say that. And so I just wanted to include this screenshot so you could see some of the different resources that were available with this campaign. And we'll be sure to include this with the follow-up email that we send, the link for you so you can look all through it. But it's a really great campaign. And it really just shows different parents in everyday opportunities talking with their children about alcohol and other drugs. And it includes tools to kind of help you start these conversations with your own kids or youth in your life. So some of the different resources, they include a lot of different fact sheets on topics like how do I know if my child has started drinking? What are some of the signs to look for? And then I talked about answering the tough questions. There's a lot of brochures and infographics with more in-depth information on it. And it talks about more than just alcohol. It's all of these drugs like alcohol, marijuana, opioids, things like that. And so one of the really cool aspects of this campaign is that they've developed a mobile app to help you, to help you kind of prepare to have these conversations. Darren, you can go to the next slide. There wasn't much to say about this first slide. So what this app offers you are practice scenarios that share conversation starters, conversation goals, possible reactions, and conversation closers, as well as other helpful information like different stats on the prevalence of underage drinking and other drug use. So the scenarios all begin with a PSA from this Talk They Hear You campaign. It's showing parents talking with their children about alcohol and other drugs based on those 5 conversation starters goals that we just went over. The scenarios then broken down to help you understand and plan for having these conversations on your own. They have the ability where you can earn badges for completing practice scenarios and for having actual conversations. And then at the end of each scenario, you can record your own practice conversation and take a self-assessment. And so they have a recording feature that allows you to practice the conversation, and then you can play it back to yourself to hear how you would sound to your child. So this self-assessment lets you kind of rate yourself on how well you feel like you achieved the conversation goal. And again, like I've mentioned, we want to keep these chats, these conversations low key, low pressure. So this is a way for you to listen back to say, is that really how I meant to come across? Do I feel like I, articulated well what I'm trying to say? So it's just, I think it's a really cool resource, and it's something that you can do on your phone. So if the weather is getting nicer, if you want to take some walks and practice this, it's a really great resource. So we'll put the link to this mobile app in the follow-up email as well. Excuse me. So, we hope at that point you've maybe had a conversation after you've had some time to look at all of this stuff. So, we'll say you've had the first conversation. That's the first step. And that's really, really well done. So again, frequent conversations with your child or the youth in your life about alcohol and other drugs, that's what's going to keep these lines of communication open. And so something that I want to think or have you think about, and people that are watching this after is, think about how you would change the way that you're talking about these conversations with, say, a 9-year-old versus maybe an 18-year-old that's about to go to prom this weekend, or a 12-year-old versus a 17-year-old. Think about just how you would reframe parts of that conversation. So you want to make sure that you're giving them information that is, age appropriate. But like we said, starting as young as 9 years old is a great time to get this started. So I know that was a lot of information. I hope that you at least got a few new tips of maybe ways that you could start having the conversation, or at least hopefully we'll take some time to look at this Talk They Hear You campaign. And if you are planning to host a party, I hope there are a few things that you've considered. And if your teen is planning to go to a party, whether it's prom, graduation, a normal, just a normal weekend party, I hope that you have found a little bit more information in terms of, maybe how to help prepare your child for being able to, when they are approached with peer pressure to drink or use other substances. I hope you got some ideas on tips for helping them to practice saying no, or to helping them come up with kind of a backup plan if their designated driver ends up drinking and they don't know what to do. Hopefully you have some tools that you can kind of chat with them about to help develop kind of that plan B, and that they feel confident in what their next choice is so that they can get home safely.